Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine chiropractor. I'm here with Erin demonstrating what postural neurology exam for her was like. And of course, this is little parts of what the full examination is, but I thought this would kind of give you an understanding of what happens with my brain-based neurology and posture examination. Just to remind you, and there's another video where Erin explains her story in detail that I'm going to make sure that I put the information so you can refer to. But Erin came here not necessarily because she was dying of pain or she injured herself, but she had experience, and Erin, please correct me if you need to interject, by all means do, that she was lacking like occasional pains and nothing to stop her from doing what she was doing, but it was not being the normal or having the normal energy or stamina,
right? Yeah,
that she thought someone her age should be, and obviously she looks young. We won't disclose any age here. And so she had been to other chiropractors. She chose to come here because of the different reviews that she had come across about myself and my practice. And so she came in, and obviously she started care, and she did explain. Erin, did you at any point feel like I talked you into something you didn't want to do?
Oh, no, not at all.
Very good, very good. So with that said, I thought I'll just show little parts of what Erin's exam entailed. And this is brain-based neurology and posture, where I examine different portions of the brain that have to do with proper posture and establish where the weaknesses are. So part of the treatment includes exercises for those weak parts of the brain. We're not talking about dementia and Parkinson's or pathology of the brain. We're talking about portions of the brain that have to do with the actual posture. Why is posture so important? Posture, proper posture, is an indication of healthy individual. You'll never see an unhealthy person with proper posture. So that's a whole different video, but we'll go ahead and demonstrate this. Maddie, are you able to see me standing here with, maybe you can step back a little bit right there. So if you recall, we did some of this exercise.
Right.
So in this exercise, I'm looking for coordination and continuation of the activity on one side versus the other. Can you switch over to the other side? And obviously we're going to make this shorter so she just missed a couple. So we're going to notice that. Thanks,
okay.
How about if we do the figure 8 and continue on?
Sorry.
So just continue with figure 8 like that. Very nice. And then bring your elbow to you and do the same over here. Just figure 8 once again. I know that's kind of a confusing move to do. So we can see, you can see. So this is telling me that Erin still needs to work on specific. By the way, this has to do with cerebellum. Portions of the cerebellum that need to be activated, as an example. Let's
see, I'm not perfect. I'm still in progress.
Go ahead and bring your arms out, close your eyes, and march in place. So in this exercise, I'm actually looking for the balancing component of the ear. It's called vestibular. That has to do with balancing. And as you can see, Erin is coming. Erin, you can stop.
Okay, good. I came out and I'm crooked.
Yes. So that part just told me that the left side balancing component of the hearing nerve needs to be activated. That's called positive neuroplasticity, but that's a whole different term. But here in this example, there are going to be exercises for Erin to do that will improve the weakness. and therefore improve her posture. Now, once that is done, then we can work on strengthening the muscles, etc., etc. Because you have to understand, if the brain is not getting what it needs to have proper balance, and it has to tweak the posture and movement to accommodate what it has to deal with, well, you will create imbalances, and imbalances in your joints and your muscles only mean injuries, aches and pains, and re-injuries. So thank you so much, Erin, for
Sorry, I didn't pass.
And you have to understand, these are the tests, the exercises that very specific to Erin. When I do brain-based neurology and posture examination, it's very unique to the individual's findings. The exercises are very unique to the findings. So Erin, I remember we tested, and I gave you an eye patch.
Oh,
you
yes.
Tell us about the eye patch. You were to wear that at home, right?
Yes. So we found out that I had a dominant eye, and it was basically doing 85 to 90% of the work, and my other eye was just hanging out. So
on vacation
doing, I don't know, just like sitting there going, cool thing. So I had an eye patch, and so I had to put it on and then do all these various different exercises to strengthen my eye so that it would actually perform and start, reading words off the page instead of being like, oh, cool, there's a speck on that wall over there.
Right, exactly. So in this case, the dominant eye was doing most of the work, was sending more information to that side of the brain, which is in charge of control and movement and sensation of the opposite side. And the non-dominant eye was not really giving enough input. So we needed to strengthen the non-dominant eye by making it work. So these are the exercises or examples of exercises that have to do with weakness of the brain with regards to the posture. Anyway, I hope you got some information out of this. Some of the questions that you may have were answered. And if you have any questions, by all means, please contact me. And I hope that you'll look into this further. Thank you for watching.
Bye.